So I now would like to introduce Dr. David Lee from the University of Miami. He has been a mentor and colleague for the last 8 years that I've been working on the Firefighter Cancer Initiative. So I'm very excited for him to share with you some of our findings of the Cancer Registry here in the state of Florida. So Dr. David Lee is a professor in chronic disease and occupational epidemiologist at the University of Miami. His research interests are in the areas of tobacco use, prevention, cancer risk, the epidemiology of hearing and vision disorders, occupational health, and the application of mind-body practices in those living with chronic conditions or other working high-stress occupations. So without further ado, Dr. David Lee.
Love the upbeat music. So I was recruited to the University of Miami more than 3 decades ago to work on a project with Local 1403 here to address cancer and cardiovascular disease risk in firefighters. And so I'm quite familiar with the fire tower here, and as I was approaching, it's been about probably 20 years since I've been here, and I had to comment to myself that the building seems to have aged better than I have in the last 2 decades. So it's really a pleasure to be here. Okay. Ooh, I think I need to get my eyes double checked here. Okay. So we're going to talk today about 2 very, very different topics. One is multiple primary cancers among male career firefighters. And then we're also going to take a look at the survival of firefighters who, in Florida, who were diagnosed with prostate cancer, melanoma, and colorectal cancers. Oh, thank you. So firefighters are at increased risk for several cancers here in Florida. There are, thank you. There are advances in cancer screening and detection just overall that has prolonged the lifespan of cancer survivors. And so what that means is that folks who were originally diagnosed with cancer have, unfortunately, in some cases, the opportunity to develop another cancer that's not a metastasis of the first cancer that they had, so just a new occurrence of cancer. And we call this phenomenon multiple primary cancers. And so what we're going to do in this part of the talk is to really compare the multiple primary cancer experience of Florida firefighters to that of the general Florida population. Earlier we published the results for primary cancers. These are the first cancers in Florida firefighters. And this is just for male firefighters, and we found elevations in risk for melanoma, prostate cancer, testicular and thyroid cancers, all of which we've had conversations about already today. So just real briefly, what we did, one of my other roles or hats is I'm the director of the Cancer Registry for the state of Florida. So we maintain all of the cancer records in the state of Florida. So had convenient access to our data, and we went to the state fire marshal's office, gathered up all the certification records that they had for both career and volunteer firefighters, and then performed a record linkage to identify those career and volunteer firefighters with cancer. So with respect to the multiple primary cancers, on the slide here is basically the risk of proportion of firefighters who had a primary cancer, a second cancer, which would be their first MPC. And we even have instances where there's a second and even a third or more primary cancers for a small percentage of firefighters. And when we look at the risk or the proportion of second and three or more multiple primary cancers, we see a slightly elevated risk in firefighters. And when we apply a statistical test to that, we basically confirmed about a 14% increased risk of having a multiple primary cancer, one or more MPCs, relative to the general Florida population. Now, we would call this a very small elevation in risk that was really right at the threshold of us being able to declare this to be a statistically significant elevation in risk. But I think it's important to note that the risk that we detected is a relatively small one. What was perhaps more interesting was when we took a deeper dive looking at, okay, what were the cancers, the second, the third, the fourth cancers that firefighters experienced. And one of the things that really just jumped out at us was the increased probability that the second, third, and fourth cancers were, when diagnosed in firefighters, were melanomas of the skin. And so in the first row here, the risk is relative to the general Florida population, about an 82% increased risk, 74%. And those rare fourth cancers, about a twofold increased risk. These were all statistically significant when we compared them to the general Florida population. So there's really something going on with melanoma. And as I indicated earlier, firefighters in Florida are at increased risk of having melanoma as a primary cancer as well. But I also want to note at the bottom of this chart that we detected actually a significantly lower risk of at least the second cancer for firefighters with prostate cancer. And prostate cancer was also one of the cancers that firefighters in Florida have an increased risk for. So it's just interesting to see that when we kind of drilled further into the data and look at the specific types of cancers, we see some real differential effects in operation for the firefighters. To conclude this part of the talk, overall, male career firefighters are slightly but statistically significantly more likely to be diagnosed with a greater number of multiple primaries than the general Florida population, and that our male career firefighters have a greater risk of melanoma as the second and third primary cancers, again, relative to our general Florida population. And we really need some more research into these occupational hazards, I think particularly with the risk associated with both primary and multiple primary melanomas in firefighters. So the next thing I want to talk about is another area that has really been understudied, and that is what is the survival experience of firefighters once they're diagnosed with cancer. So we've been focusing our attention on three cancers, prostate melanoma and colorectal cancers. And for these first two, these analyses were done in males only because we just lacked a number of female firefighters with those. Well, obviously no prostate cancer. Hopefully it was detected in the female firefighters. But the colorectal, we included both male and female firefighters. And so we're interested in looking at what's the survival experience, and then also once we statistically control for a number of factors, do we see differences in the survival experience of firefighters relative to the general Florida population. So we controlled in that analysis for a number of like sociodemographic variables like insurance status, and then a number of clinical characteristics around the cancer itself, as like stage of diagnosis, for example. So when we look at the 10-year survival experience of firefighters, one of the things that really jumps out is that in general, the survival experience for at least 2 of the 3 cancers is really superior in the firefighters relative to the general Florida population. So for example, if you look at melanoma, which is at the top of the screen, our career firefighters, their survival rates exceeded or approached 90%, with our volunteers having a lower survival rate, but still actually superior to the survival rate of other broad occupational groups. And we gathered that information from the cancer record, which will report the longest held job of that particular case. So we were able to group these other cases into broad occupational groups when the data were present. So let me orient you to these slides. Now this is the analysis that's adjusting for all of those variables. We have a vertical line in the middle of this graph, and if you find yourself on the left-hand side of that graph, you have a lower risk, a relative survival, or proved relative survival to the comparison group, which is different according to the row. And then the dot is the estimate of the effect, and there's what we call error bars on either side. And if those error bars do not cross that vertical line, we consider that to be a statistically significant, either reduced or increased risk. And for prostate cancer, when we compare the survival experience, adjusting for all these things in the Florida firefighters versus the general population, did not see any real statistically significant differences. And we also looked at our firefighters with respect to these other occupational groups, broad categories of like white collar, which would be most similar to the category that was presented in the previous talk about the CPS studies. And basically, you can see that those error bars are crossing that vertical line. So even though the firefighters seem to do a bit better, none of these differences were statistically significant. Now, it's a different story when we look at our other 2 cancers. When we compared our firefighters versus non-firefighters, in this case, the firefighters included both career and volunteers. There was a significantly better survival among our firefighters relative to the general Florida population. And when at the bottom there, we're comparing the experience of our career and our volunteer firefighters. And even though there was evidence that the career firefighters were doing better, that was not quite statistically significant. And then when we compare our firefighters to these other broad occupational groups, we see a really consistent and clear pattern of improved survival, better survival in firefighters relative to these other broad occupational groups. And for colorectal cancer, we see a very similar pattern as we saw for melanoma. Our firefighters are doing better overall relative to non-firefighters. Our career firefighters doing a bit better, but not statistically different from our volunteer firefighters. And again, a general pattern of superior survival in firefighters relative to these other broad occupational groups, although the effect for service workers versus firefighters was kind of a borderline significance. So to wrap up here, there were no significant prostate survival differences between firefighters and other broad occupational groups. However, firefighters diagnosed with skin melanoma and colorectal cancer had significantly longer overall survival relative to other broad occupational groups. And there were no significant survival differences between volunteer and career firefighters for the 3 cancers examined. And I should say that, you know, why do we think we're seeing these superior survival experiences for our Florida firefighters, at least for 2 of the 3 cancers? Well, one thing that we can speculate on is we've got this unique, healthy worker group of firefighters who just may be better prepared, you know, to fight the cancers that they're, at least the 2 that we're talking about. But the other thing that I would also mention is that, you know, many of our firefighters in the state of Florida are cross-trained and certified as either EMTs or paramedics. So they, you know, the amount of medical training in this profession is quite high. Many of the volunteer firefighters, you know, might be EMTs themselves, and so there just might be a better, more successful engagement with the whole process of undergoing, you know, the rigors of chemotherapy or radiation or surgical outcomes. And compliance, and just a more informed patient. And that's one possible explanation as well. So I'll stop there, and I thank you for your attention.